This morning, we are continuing our series, Outsmarting Allergies. Yesterday on the morning show, we told you about a treatment that works to help children who are allergic to peanuts build a tolerance to the allergen. Now, this morning, we are focusing on medication. Research shows a majority of people who were told at some point that they may be allergic to penicillin actually are not. Local allergist Dr. Sunil Joshi is joining us live this morning via Zoom. Good morning. Thanks for being with us, Doc.
Good morning, Jen. Thanks for having us.
So how is it possible that someone who essentially has been told probably since they were a child that they're allergic to penicillin, and it now turns out that maybe they really aren't?
Yeah, what happens is when we have an infection, whether it's a virus or a bacteria, there's about a 10% chance that we can develop a skin rash associated with that. So if you have a bacterial infection and you start on an antibiotic, like a penicillin-based antibiotic, and then develop a rash afterwards, the first thing that people think about is, oh my gosh, I'm allergic to penicillin. And the patients are then told to avoid that the rest of their life, when in fact, that rash might have occurred as a result of the virus or the bacteria itself and have nothing to do with the penicillin. But unfortunately, then you're labeled as being penicillin allergic.
Oh, so it's interesting. I mean, how many people are we talking about? Because I'm thinking about, both of my children had hives or rash associated with different medication. One of them amoxicillin, which is in the penicillin family. And right. I have told him, don't ever take amoxicillin again as a result. I mean, how many people are we talking about here?
Well, 10% of the population is labeled as penicillin allergic. And so it does involve a great number of the population. And the problem with that, just like you just mentioned with your own son there, is now he's not going to get amoxicillin or a penicillin-based drug for common infections, or if he had pneumonia or something of that sort, and he'll end up taking antibiotics that may be less effective and certainly more costly as well. And so sometimes this mislabeling it leads to less effective treatments and also more costly treatments.
So you mentioned 10% then who were told that they were allergic to penicillin are not? Typically?
That's right. That's right. So if you look at the entire population of folks who think that they're allergic to penicillin, once you actually get an adequate history from that patient, so in other words, try to understand what was their reaction and what was the timing of their reaction. Typically in that case, only 10% of those people truly are allergic to penicillin once you get that history. And if it's been more than 10 years since that reaction, only 10% of those people are still allergic. So if you started with a group of 100 people who said they were allergic to penicillin, and it's been more than 10 years since the reaction, and you go through the history and the timetable, only one of those people may truly be allergic at the end of that history.
And is this just penicillin, or should people reconsider allergies to other medications maybe that they had a reaction to when they were younger?
And I think for antibiotics in particular, you should reconsider that. We have a lot more data with penicillin because we have standardized testing for that, and that's how we know these 10% numbers. But the same is probably true for most other antibiotics and some of the other medications that may be prescribed as well. Certainly worth revisiting if these are medications that you feel like you will need in the future, like penicillin-based antibiotics, which as we get older become more important for us, especially in our 60s or 70s where pneumonia, which of course can be treated very well with penicillin-based antibiotics.
So how does someone test then to know for sure?
Yeah, with penicillin, there's a great standardized skin test. So very similar to how we would skin test for peanuts or other types of allergies. But we test for penicillin and a breakdown product of penicillin with a skin test. And then if that's negative, it rules out the allergy by an additional 95%, at which point to completely rule out the allergy, we actually would give the patient amoxicillin here in the office and watch them for an hour.
And would you explain again why it's important to maybe retest? I mean, you touched on this because I've talked to you about actually doing this with my son, but the importance of knowing, that there are certain medications that you can take if you've thought that you couldn't in the past.
Yeah, absolutely, especially penicillin, as we're talking about that right now, because again, it's very likely that you were mislabeled as penicillin allergic. Okay, so if you get skin tested and find out that you're not, then you can feel comfortable taking the drug again. But also, as we get older, especially our folks in their 60s, 70s, and 80s, what puts us in the hospital with infections is typically respiratory infections, community-acquired pneumonias, that are best treated with penicillin-based antibiotics. And so if you have community-acquired pneumonia, you go to the hospital and you're labeled as penicillin allergic because of something that happened when you were 6 years old, they're not going to give you that penicillin-based antibiotic. They're going to give you the second choice, which may be less effective and certainly would be more costly. And all along, if we would have just done the evaluation when you were healthy, you would have been able to get the best antibiotic for your illness.
Such an important, way to understand this, certainly, and to really kind of ask more questions, particularly if you have an allergy to medication. Dr. Joshi, thank you for your time this morning. We appreciate you. And we want to remind our viewers, absolutely, and we want to remind our viewers, always talk to your doctor. Don't start, testing things out to see if you're allergic without being under the care of direct supervision of a doctor. We'll be right back.